This right here in our hand is a miracle. It has the power to cure a disease that just a few decades ago was in death and tax. It's the result of 20 years of research and billions of dollars in funding. However, as we navigate the new frontiers in modern science, we realize that even the most powerful and advanced medicines are useless if the patient never reaches the clinic to receive it. You see, in healthcare, we're actually navigating two quite different maps. The first map is the frontier of biology. It's the scientific map. It talks about the heart rates, the cure rates, clinical diagnosis, CT scans, MRI scans. It's good, logical, and predictable. On the other hand, we have the human map. It's a frontier of psychology. It talks about the patient mindset, the doctor mindset, the fear of judgment, and the social stigma. However, there's a specific term for the important fear found in the human map. It's known as iatrophobia, the clinical fear of doctors. To some of us here, they might sound amusing, or not. But to a patient sitting in their car in the hospital parking lot, it's not just a fancy Greek word. It's a barrier. It's a wall they don't know how to cross. We've all heard the phrase, an apple a day keeps the doctor away. This phrase, on the surface, is quite simple. A simple advice asking you to take care of your health, have a healthy diet, and prevent diseases. However, when you look at the second part, it's like peeling the surface off and looking at something deep and dark inside. A picture of a doctor portrayed in such a way that creates a gap between the doctor and the patients. Today I want to talk about how the next frontier in medicine isn't just about better drugs. It's the understanding that, well, how can we navigate the human map and also bridging the gap between the doctors and the patients. Please raise your hand if you've ever felt scared to go for a doctor's appointment. Raise your hand if you've used Google search or AI prompts instead of going to a real doctor. Keep raising your hand if you trusted those search results. Please keep your hands down. Thank you. I grew up around doctors, meaning my vacations were the classic nanny's house vacations. They often included overhearing phone calls, conversations about hospital and from the hospital. And those stories were rarely about the scientific map. They were about the human map. The patient who hesitated to talk about the symptoms, the patient who waited so long to get diagnosed, and the patient who knew something was wrong but just couldn't say it. Medicine doesn't just deal with biology, it also deals with psychology. Take hepatitis C for example. We have a cure rate of over 95%, yet millions remain undiagnosed because fear of judgment, social stigma, and iatrophobia are mountains patients are not ready to climb, even if it is at the risk of their own health. We say prevention is better than cure. This phrase is almost a mathematical truth or a statement. The survival rate of many cancers is over 90% in stage 1. However, it drops to less than 20 in stage 4. Prevention is the ultimate frontier in medicine. However, it can only truly work when the patient feels safe enough to be heard and to be seen. To understand how doctors are navigating this frontier in their careers and how they are bridging the gap between themselves and their patients, I have conducted a survey within the medical community. 80% of the doctors I surveyed see patients in a life-saving diagnosis very often, specifically because of iatrophobia or social stigma. 100% of respondents, every single doctor, confirm that patient trust, patient cooperation are primary predictors of whether treatment will succeed. And over 60% of the doctors I surveyed admitted that they personally feel that emotional pressure and stress because of patient mistrust. However, the most revealing parts of this investigation weren't really these statistics. They were the misconceptions, the common misconceptions noted by the doctors. One doctor noted a very common heartbreak. Many patients think doctors are only money-minded. Is that a truth we subconsciously bought into? Because of the doctors I surveyed, the reality is the emotional toll of trying to convince a patient to trust science over a hoax. Another reminded us that the public often overlooks the most important part of the doctor-patient relationship, that healing is a shared responsibility. Without the cooperation, clear communication and collaboration of both the doctor and the patient cannot truly heal. But perhaps the quote that stayed with me the most was from a surgeon who wrote, the biggest challenge isn't the surgery, it's the belief that doctors must have all the answers at all times. That is reflected in that last statement. Most of us here expect our doctors to be infallible, to have perfection, to have all the right answers at all times. However, we often forget that when we choose perfection, that allows you to truly heal. So the next frontier in medicine isn't just about discovering new molecules. It's understanding that when a person walks through the clinic doors or the hospital gates, they're not just bringing a story with themselves, they're also bringing body to be checked upon. Psychology and biology should be balanced for a good healthcare system. Finally, I challenge you. The next time you feel that fear flickering in yourself, or that, oh, should the Google search an AI prompt decide your fate? Don't. Be the explorer of your own health. Choose the human connection, cross the barrier of hesitation, and walk through the door. Because the greatest discovery in medicine isn't a drug or a medicine vaccine. It's a trust that allows you to truly heal. Thank you so much.